The zygomatic bone, or zygomaticum, is a paired bone that creates the lateral part of the facial skull and also the lateral wall, partially the lateral wall of the orbit. It has three surfaces, three protrusions or processes, and three openings. Inside, it will have a tunnel that splits in a Y shape, so that's why we have the three openings. The three surfaces are as follows. We have facies orbitalis that ends at margo infraorbitalis and passes into the lateral surface facies lateralis. And then we pass into the posteriorly looking facies temporalis, which is oriented towards the temporal and infratemporal fossa. The extensions are processus frontalis towards the frontal bone to join up with the zygomatic process of the frontal bone. We have processus maxillaris right here that joins up with the zygomatic process of the maxilla, and posteriorly extending we have processus temporalis that will join the zygomatic process of the temporal bone to create the so-called zygomatic arch right here. The openings are on the surfaces. Each of them has one. So we have foramen zygomatico orbitale in the orbit. We have foramen zygomatico faciale on the lateral surface, and we will have foramen zygomatico temporale on the temporal surface. The articulated bony zygomatic bone has similarly the three surfaces, three extensions, and three openings, but this time on a true bony skull. So we have facies orbitalis inside the orbit. In its middle, or in this area of it, we'll have foramen zygomatico orbitale. Margo infraorbitalis partially belongs to this bone. Then we pass on to the lateral surface, facies lateralis. With this time we have two openings, we call foramen zygomatico faciale. And then posteriorly oriented, the posterior surface or temporal surface is oriented towards the temporal and infratemporal fossae. So facies temporalis, which holds the foramen zygomatico temporale. And the three extensions, processus frontalis towards the frontal bone, processus maxillaris towards the maxilla, and processus temporalis towards the temporal bone, which is partially broken off on this bone to create the arcus zygomaticus.